Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Iqbal Naufal bin Sahirun. My matrix number is BM25110022. My SSM is talking about erectile dysfunction. Before I start my conversation, let us know first if they are OBG doctor for solving female problem. Therefore, they are also must be a doctor that's solving male problem. That's me, andrologist. Before that, do you know what is erectile dysfunction, or commonly said ED? ED is inability to obtain an erection. This may result from a lesion of the prosthetic plexus or cavernous nerve, such as central nervous system. This result no stimulus to the erectile tissue. Therefore, blood vessel may be insufficient to respond to the autonomic stimulation, usually hypothalamic, and the endocrine disorder, which is causing reduced amount of testosterone secretion. Now, what are the common treatment that we do in Malaysia for solving ED? The procedure is involved surgically implanted semi-rigid or inflatable penile prosthesis. Other option is involved assisting of oral medication and a medication injection that increase the blood flow into the cavernous sinusoid by relaxation of small muscle. Now, what are the epidemiology of ED currently in Malaysia? Because of increased risk factor of by NHMS 2022 report that NCD risk factor are climbing. 15.6% of adults have diabetes, 29.2% have hypertension, and 54.4% are obese. This trend, along with a 29.9% prevalence of physical inactivity, this implies more men will develop ED. Younger generation is particularly show rising rate of obesity and metabolic disease. This potentially increase the ED at early ages. What are healthcare do? The Malaysian Minister of Health has recognized this ED as important male health issue. In 2025, the MOH released clinical practice guidelines, especially for ED management. So it will increase the public awareness by doing public awareness campaign. Last but not least, a health official note ED should be treated like other chronic conditions such as diabetes, hypertension, and also call for screening of men with high risk. Overall, while nationally representative ED prevalence data for 2020 to 2025 are lacking, the upward trend in diabetes, obesity, and hypertension recorded by NHM 2023, along with growing clinical recognition, suggests Malaysia ED burden is likely increasing in this period. Now, what are the causes of ED? One of the causes of ED that I have studied is vascular causes that prevent the blood flow to the penis. Other than that is neurological causes. Other than that is hormonal causes such as the reducing amount of testosterone, psychological causes, medication-induced and iatrogenic causes such as the antidepressant medication, and other than that is anatomical causes. For example, the the prostate and the urethra is blocked due to last before surgery. Now, chronic systemic disease such as I mentioned about hypertension, obesity, and other than that. Last but not least, lifestyle and metabolic factor. Now, what are the treatment of ED? Firstly, the treatment that especially in Malaysia do is first line medical therapies. Other than that is second line or combination therapy. And last but not least is mechanical and device optional. Now let's talk about first line medication therapy. These are by far the most common first choice treatment for impotent or we call ED in Malaysia and across Asia. This enhance blood flow into the penis in response to sexual stimulation and are recommended as first line therapy in most treatment guidelines and clinical practice in the region. Usually, we are use tadalafin that's in the picture and what the organ disorder which is we mainly focus on the arterial supply of the penis, usually the internal pudendal arteries that may be blocked, so we give them this oral medication so it will enhance the blood flow. Now let's talk about second line or combination therapy. Second line or combination therapy usually used if the first line therapy is does not work or not tolerated. I'm sorry. For example, the treatment we use is ICI, which is I'm sorry, intracavernosal injection, which is we do injection in the body of the penis. Last but not least, we also use intraurethral alprostadil, which is the injection that contain alprostadil. This injection straight to the the glands of the penis. Now let's talk about mechanical and device option. Usually in Malaysia, we recommended the vacuum erection device or usually called penis pump. This use because it is a non-invasive option when also the second line and the first line medication does not work. Last but not least, what are the options we recommended to the patient that has ED, which is it will go consult consultation with the specialist and usually specialist which is me in andrologist will give them option to do low I'm sorry we usually specialists will recommended this advanced procedure which is we give them Lee SWT or called low intensity shockwave therapy. By using this therapy, we will improve the blood flow and the vessel health. Other than that, we also a surgical option, which is we will give them a penile prosthesis implantation in the body of the penile. It consider it when other treatment fail. or are not suitable. Other than the treatment in medication, we also give them a supportive care, which is we use the lifestyle and risk factor management approaches. Usually, we give them option to do exercise regularly to prevent the chronic disease, weight control, to prevent the obesity and smoking cessation, diabetes and blood pressure control, and also we give them a counseling about their psychological disorder. And below that, we can give them a hotline that specially for a patient that has ED. I think that's all from me. Bye bye.